Clavicle with your scapular video. So here it is. Remember, it is the S-shaped type bone. Comes down here and meets on the medial end with your sternum or breastbone. This is then called the sternal end of your clavicle. And you follow it all the way out to the lateral end where it meets the acromion process of your scapula. This is then called the acromial end of your clavicle or lateral. Where it meets here, it is called the AC joint, where the clavicle bone meets the scapula at the acromion process, acromioclavicular joint. Follow it back to the medial sternal end. This joint is called your sternal clavicular joint. All right, we're going to now go to talking about the humerus. This is a right humerus. We're going to talk about the proximal end. If you refer to your sheet where you have the various bony landmarks there. You're going to have a greater tuberosity here, the lesser tuberosity here, and then down the center between the two is this groove called the intertubercular sulcus, or also known as bicipital groove. Obviously you have the head of the humerus, and this is what will fit in to the glenoid cavity to make a nice joint that is freely movable. All right, you come down to about mid-shaft on the lateral aspect of the humerus here is going to be something called your deltoid tuberosity. It is where your deltoid muscle will insert. Come all the way down to the distal end of your humerus. You're going to have a couple different fosses, which I'll talk about in just a second, but on your list you have first the medial epicondyle, big bony projection on the medial side of your arm there. And then on the lateral, it's not as prominent, is the lateral epicondyle. You'll have what's called your capitulum. Whoops, right here is your capitulum. And this is your trochlea. And this is going to be the coronoid fossa here. On the posterior aspect of the humerus is this nice big indentation here. It is called the olecranon fossa. This is where when your elbow is straight, your arm is straight, the olecranon process will fit right in here, which I'll show you here that shortly. I think that's all of those bony landmarks there. All right, we're gonna go now to the proximal end of your ulna. So this is a ulna. It's going to fit right in here like this. And remember, your ulna is considered the non-movable bone in your forearm, and it is considered also the more medial bone of the forearm. So this part right here of the ulna fits nice and neat right in here in the trochlea, and forms a nice joint right there. So then when you actually have your arm completely extended, the olecranon process, which everyone refers to as your elbow or the funny bone, when it's extended, it actually slides nicely, neatly in up to the olecranon fossa there. All right, so you also have the ulnar tuberosity, which is located right here. It's just a bony projection for a muscle attachment. All right, then we have the radius. So the radial head is right here. It's going to fit nice and neat here in the capitulum. And we always refer to it as, because this is the radial head, capitulum cap on your head. So radial head with the cap. So that's kind of a great way to remember that particular part. So it fits right there and forms a nice smooth movement for your elbow. You have a bony landmark here. It's actually going to be located right next to the ulnar tuberosity. And then on the radius, this is called your radial tuberosity. You follow the radius all the way down. It's going to have this bony projection on your own body. If you follow it down, because it's thumb side, it's right here called the styloid process. And I neglected to say that the radius is considered the more movable bone because it rolls over on top of the ulna, and the radius is considered the lateral forearm bone. And then I did neglect to tell you distally on the ulna, we have this bony projection right here, and that is called the stylid process of your ulna. Also distal ulna, this is the head. The radius head, the unique part is the radial head is proximal, the ulnar head is distal. And that's it.